The main identity security challenges we faced at NHSBT was a lack of multi-factor authentication for administrator accounts, as well as an inability to effectively and easily manage service accounts or non-human identities. I'm Daniel Bhatoa and I work as an Identity and Access Management Engineer. NHS Blood and Transplant manages England's blood supply chain, and we also manage the UK's organ donor register, and ultimately it's all about saving and improving lives. We've seen in the past with attacks such as WannaCry and the Synovis attack in 2024 that disruptions and delays to healthcare systems has a negative impact on patient services. In the past, a pen tester tested one of our systems. They managed to compromise an account and they managed to elevate privileges with this account. By using lateral movement and escalation of privilege, they've managed to actually gain a lot more access than they should have. Enforcing MFA for domain admins was very difficult because Active Directory has no native support for MFA challenges for admin accounts. Particularly when you've got legacy systems in place.
Service accounts created additional risks for us because some of them were implemented 20 years ago and we simply couldn't switch them off just like that because that could cause an impact to patients for us. We had a meeting with the Silverfort team where we were able to see the product, familiarize ourselves with it. And then after that, we had a proof of concept where we were able to see how it's going to work within our environment, what the impact will be, and how our users will experience the product as well.
All NHS organisations need to comply with the Cyber Assessment Framework, which is a framework put forward by the government to protect and secure NHS systems. One of the requirements of that framework is that all the privileged accounts should be protected with MFA. Silverfort helped us to meet that challenge. Now, for example, whenever somebody authenticates against Active Directory and elevates their permissions, we get an MFA challenge, and then we can see whether they've authenticated successfully or not and responded to that challenge. And it gives us a high level of confidence that Joe Bloggs, for example, is the administrator who's actually performing a particular action.
What I would say to other healthcare organisations considering Silverfort, I'd ask, what are you waiting for? Why? Well, because it's easy to deploy and straight away gives you the return of the investment. It gives you the visibility of every single authentication that is going through your Active Directory. You see what users are authenticating against, what your service accounts are doing, and that is just priceless.